Henry Ford study. For instance, the patients who received hydroxychloroquine were handpicked and they tended to be healthier. They were also twice as likely to receive steroids, which are proven to have a benefit. That's why randomized placebo-controlled trials, which Dr. Fauci does refer to as the gold standard, are so useful. And I know you know that. And that is also what the epidemiologists, that's what the epidemiologists, including the ones I've spoken to, say is simply the standard for the FDA. And also, again, the issue here isn't, I'm not disputing that you have cited these other studies, these subgroups. I'm not disputing you've cited these studies which show a benefit in subgroups. But the problem is when put up against the random placebo-controlled trials, none of which have shown a benefit. There is a conflict there which has caused the FDA pause.
I'm sorry, but you have actually three or four wrong statements in what you said. First of all of those randomized controlled trials were not blinded. The people knew which medications they were taking because it was stamped on the pills. So to say that there's no bias in those trials is already, and the people self-reported their symptoms. So to say that those were gold standard trials is just nonsense, because the same bias was present in those as in any other kind of potential biases in any other kind of study.
They were selected randomly.
No, that's not enough. That's not enough. Randomization does not make the subgroups perfect. It can push in that direction, but there can be residual non-randomization in studies, especially ones as small as the ones in the Minnesota study. Randomization is a theoretical goal. In real world, it does not work perfectly, and there can easily be confounding by lack of adequate randomization. You need tens of thousands of people in order to have randomization that works. In a few hundred people, it does not work.
Harvey Risch on CNN this morning with John Berman, who appeared to be debating Dr. Risch rather than interviewing him. It's Monday, August the 3rd, the year of our Lord 2020, War Room Pandemic, live from Capitol Hill. Jack Maxey, Raheem Kassam here on Newsmax, on America's Voice, on the John Fredericks Radio Network, and blown through the Chinese Communist Party's firewall into mainland China, subtitled in Mandarin by G News and GTV. And we have Dr. Risch joining us on the line, fresh off that CNN interview this morning. Dr. Risch, thank you so much for joining us here on War Room Pandemic.
My pleasure. Good to be here.
Doctor, we just played that clip, about a minute and a half clip of you from CNN this morning. And I'm not one to typically watch CNN first thing in the morning, but I threw it on by happenstance and saw you on, turned it up, and just watched the whole thing take place. And what I really want to know is, in that scenario, John Berman had you on to debate you, not to interview you, and it sounded there and over the course of the whole interview like you couldn't get a word in edgeways. I realized that you had a little bit of a run at the end, but again, him trying to talk over you, trying to cut you off. I just want to understand for the audience out there who saw that and who watched that clip just now, and then I want to hand over to Jack Maxey, Steve Bannon as well. Dr. Risch, how did CNN build this interview with you when they pitched you to come on? Because immediately after you were on as well, they had a panel of people to just trash what you had said on national television, Dr. Risch.
So they billed it as an interview, and I know that they did the same thing to Peter Navarro a week or so ago, so I was prepared to think that that's what they were going to do. And science isn't a vote. The evidence is what it is. Nature speaks, and you measure it, and that's the truth. And it doesn't matter whether they have 5 or 10 or whatever people after me, saying nonsense, that it's not them to figure out what they think. It's what science is saying and what the evidence is saying. So I just rely on the evidence that speaks for me. I have no stake in this. It's the evidence that has the stake in it.
Jack.
Yeah, Doctor.
Hey, Dr. Risch.
Really
hey, Jack. Let me just jump in. Hey, Jack. Let me just jump in here for a second. I just want to get very basic. Dr. Risch, just then make your case. What is the evidence? You're at Yale Medical School. You're one of the most renowned guys in this area. John Berman's just some, morning talk show host. He's trying to get in a debate, and every time he's talking, you're actually correcting him. And remember, he's got a producer in his ear trying to give him updated facts to debate you. Just walk through. When you say, hey, science is not debatable, walk through once again. We're going to give you time to walk through the basic case you're making from what the evidence, the data, and the science which is the mantra of CNN, the mantra of Dr. Fauci. Can you just walk through what the evidence, the data, and the science shows you?
Okay. So the first thing is that Dr. Fauci has been maintaining that only randomized, controlled, double-blinded trials provide evidence worth relying upon to decide whether a medication works. And that is a standard that has never been imposed neither by the FDA nor by the scientific community in general. The large number, if not the majority, of medications used for the last 50 or 70 years across the world were not established by using randomized controlled trials. A lot of combined chemotherapy for cancer was never established by using randomized trials. Antibiotics, as I said, amoxicillin, which is billions of prescriptions of amoxicillin for every time a child comes down with strep throat and you get a prescription for it. That was never established with a randomized controlled trial. Dr. Frieden in the New England Journal said in a long essay, here's how you evaluate evidence for something. It's not just randomized trials. They have flaws and failures in the real world. You take that into account when you evaluate their evidence, and you also look at what are called phase 2 information, which is all the non-randomized trials and other evidence. And that is all part of the thinking of evaluating evidence, which is what epidemiologists do day in, day out at looking at science. So the first point is that all of the evidence needs to go into this discussion, not just a shibboleth of randomized controlled trials or nothing. That leads to what is the evidence. The evidence is that there are now 12 studies looking at the use of hydroxychloroquine plus additional medications. It could be zinc, it could be azithromycin, doxycycline, steroids, and so on. All of these are in use in various places that have been studied. There are 2 studies in Brazil that were actual trials of use. The first one was in the Prevent Senior HMO that was published by investigators that showed that that hospitalization was reduced 4-fold or so by use of hydroxychloroquine plus azithromycin. The second is a study that has been submitted for publication that is not generally available just yet, that also shows a similar thing, that 700 patients came to a large HMO that has 6 million members across Brazil, and those doctors all across the clinics of that HMO were given the choice how they wanted to treat the patients with 6 or 7 drugs. Among them was hydroxychloroquine and so on. And what they found is hydroxychloroquine cuts risk of hospitalization in half, more than half. So does prednisone in that study. So here you have more evidence, first-rate evidence for large numbers of subjects in a controlled study, just not randomized, but still a controlled study, adjusted for all possible relevant confounders that could be really responsible for the benefit, showing the same thing. Then you have the studies of patients actually treated. Now, when you say a study is anecdotal because it's a case report of 1 person or 2 people, that's what anecdotal means. But when you do a case control study where you interview 50 or 100 or 500 cases of a study, that's epidemiologic work. That's a case control study. Here what we have is the case part of case control studies. So these were studies of sequential patients that were treated with hydroxychloroquine and azithromycin, zinc, and so on by various clinicians across the United States that showed tremendous benefit, much more benefit than the trials, because these were patients who were being treated individually, and individual treatment is not formulaic. Individual treatment is giving a prescription, seeing how the patient does, adjusting it on a day-to-day basis as you need to get the patient better. And these studies show immense benefit. The study by Dr. Zelenko, his first 405 patients with 2 deaths. His second study with 400 patients, no deaths. 6 or 7 other clinicians across the country, again, with a total of 500 patients, no deaths. These are all high-risk patients who had probably a 10 or 15% mortality risk if they had not been treated, and no deaths. Now, people say, okay, well, those are people you found out about. Those are clinicians that you found about because they had such good results. They came to you to tell you how good their results were, but they're not representative of how treatment goes across the country. Okay, so that's a theoretical argument. But let's say we do this. Dr. Zelenko and Dr. Proctor in Texas both reported to me their initial series, the first 405 of Dr. Zelenko and the first 50 of Dr. Proctor. And then they said, you know what? We'll go and we'll get more patients and we'll treat them and we'll show you how good it works. And Dr. Zelenko did exactly that. He treated another 400 patients, no deaths. Dr. Proctor, another 50 patients, no deaths. Now the question is, what is the probability that they could have done that now that you're saying, here are the people you're actually going to look at. Here are the doctors you're actually going to look at. The probability of them doing that is less than 1% and probably 100-fold less than 1%, with the risk that an untreated patient at high risk would actually not get hospitalized or die. So there is very substantial evidence that these drugs work dramatically.
Dr. Risch, we've only got about 3 minutes here in this segment. I want to throw it over to Jack Maxey with a question as well here. But I want to understand this as well, because you probably recognize some of the talking points that John Berman was coming back at you at on CNN this morning. Where is he getting that information from? Because it sounds to me like this was, as they say, they billed this as an interview, but it turned into a debate. He's got somebody in his ear. He sounded like he was reading from a teleprompter at certain points. Where are those counter narratives coming from? And why didn't you get the chance to say exactly what you just said on air in full on CNN this morning?
Well, the lack of my ability to say that was their programming needs. Where he gets his points is those points are prevalent across the field from the top down, from Dr. Fauci down, saying, I'm not entertaining anything. When I call something anecdotal, what I mean is junk. That's his code word for junk. And that's totally inappropriate. As I've discussed, the widespread use of non-randomized controlled trial evidence for everything we do, lots of things that we do. So the other approach is to smear all the distinctions, that you do a study in people who can't possibly get hospitalized, and you say that applies to people who are at great risk of being hospitalized. That's an irrelevant study. Those are the Minnesota studies and the Catalonia studies. Those are low-risk people who do perfectly well without any treatment at all. And then you say, see, the treatment didn't do anything. But of course, the untreatment, the lack of treatment did great to start with, so there's no room to do better. Those are not people.
Dr. Risch, it's Jack Maxey. A quick question, because I think it really illustrates this whole debate on a global basis. You gave us the example in Brazil where they started using hydroxychloroquine, saw a dramatic drop. We've seen some other areas in Latin America. The city of Guayaquil in Ecuador went from 460 dead on, I believe it was April 6th, to 0 on May 10th using hydroxychloroquine in mass dosing across the city. Can you give us some examples of countries around the world where they've used hydroxychloroquine and seem to have lower death rates than we do? Dr.
Risch, we've got about 45 seconds here.
Okay, so in the northern part of Brazil, in Pará, Brazil, they did that. In India, in Vadodara, in the western province, I think, of Gujarat, they've done that. They gave 340,000 people across the city hydroxychloroquine, and then they sampled 100,000 and looked at who got the infections. In fact, the more doses of hydroxychloroquine you got, the lower the risk of infection, and the more doses you got, the lower risk of mortality. So it worked both to prevent getting it and dying from it.
Dr. Risch, I mean, we're really grateful to have you on, and really grateful to Steve as well for making sure that we actually have the time, unlike John Berman, on this show to get more down into nitty-gritty. Department of Chronic Disease Epidemiology at Yale School of Public Health. Dr. Risch, thank you so much for joining us here on War and Pandemic this morning.
My pleasure. Thank you.